Good morning, and welcome to the Medical Facts series of medical lectures. Today we're going to talk about a condition called sarcoidosis. That's S-A-R-C-O-I-D-O-S-I-S, sarcoidosis. Most people have probably never heard of this unless you or your family member had had the illness before. The symptoms of sarcoidosis are fairly nonspecific. It might include shortness of breath, a dry cough, red bumps or patches on the skin, fatigue, occasionally weight loss, blurring of vision, swollen lymph nodes, or even arthritis type symptoms. None of these really particularly point to sarcoidosis, but are included in what sarcoidosis can do. It's a condition we really don't understand very much about as far as the origins of it. We kind of suspect it's an abnormal immune response to some environmental exposure, but there are also genetic factors. Things we know about sarcoidosis is that it is more common in women than in men, and more serious in women than in men. It's more common in blacks than in whites, at least in the United States, though interestingly in Europe it's more common in Scandinavia for some reason. It's more common in coastal areas than it is in the interior of the country, and we don't really know the reason for any of that, but it presumably is a reaction to something that exists in those geographical areas. We don't really think sarcoidosis is something that you can inherit because while it occasionally happens in family members, it doesn't happen often enough to make you think it's an inherited illness. But of course, family members many times live in the same regions and have some common exposures and have common genetic susceptibility perhaps. Sarcoidosis causes a special type of inflammation called granulomatous inflammation. Granulomas are a collection of white blood cells that sort of wall off something foreign. So if you inhale bits of talcum powder, for example, your body can't really kill talcum powder, so it will create a wall or a little ball of cells around the talcum powder. Certain infections also cause granulomatous inflammation, such as tuberculosis. And when you have a patient with sarcoidosis, so you have to consider if they have tuberculosis or if it actually is sarcoidosis. There's another side illness that is very similar to sarcoidosis that may one day lead to a better explanation of the disease, and that is beryllium exposure. Beryllium is a special metal used in nuclear materials, and people that have exposure, usually occupational, to beryllium can have a syndrome that is almost indistinguishable from sarcoidosis, with many of the same symptoms and even the granulomatous inflammation. Most cases are diagnosed between ages 25 and 40, and it's a fairly rare disease with fewer than 200,000 cases at any given time in the United States. Symptoms, if there are any symptoms, come from changes in end organ tissue caused by this granulomatous inflammation. Lymph node swelling, for example, is a common symptom or finding in sarcoidosis, and this can include in the neck and the chest and the groin and various areas where you already have lymph nodes, but the lymph nodes can swell up, and if they swell up rapidly, they push things around. That could even lead to chest pain. You can also get joint pain and arthritic symptoms, as already mentioned, and in more severe cases of sarcoidosis, you can develop fibrosis or scarring in the lungs that can limit breathing capacity. Occasionally, people with sarcoidosis can develop pulmonary arterial hypertension, and I have a lecture elsewhere in the series about pulmonary arterial hypertension. Sarcoidosis usually is a nuisance illness and many times is already in remission when it is diagnosed. And cases that are in remission don't really require any specific treatment. But if the disease is active, it is typically treated with medications that suppress the immune response. Classically, this would include steroids such as prednisone, which can be very effective and work quickly, and prednisone is very inexpensive, but the problem is that prednisone has about 100 side effects, so it's not a good long-term solution to the illness. Other medications include methotrexate, which is an old chemotherapy drug today most commonly used for treatment of rheumatoid arthritis, but lower doses can also be used to suppress the immune response from sarcoidosis. There are biological agents such as Remicade that can be used, and many patients can be treated with Plaquenil or hydroxychloroquine as well to suppress the immune system enough to get sarcoidosis under control. How do you know if sarcoidosis is active or not? Well, if you have progressive symptoms, that's one clue. What we typically do now is order a PET scan, which is a scan usually used to detect cancer, but it'll show areas in the body that have active inflammation. And if you have active inflammation in areas typical of sarcoidosis, this could indicate that the disease is active and will require treatment. You can also use the PET scan to determine the response to therapy. So if after treating the disease with prednisone or methotrexate or Plaquenil or other agents, in a few months you can repeat the PET scan, and if the treatment is working, there should be a reduction in the hypermetabolism seen in the various lymph nodes or other sites that may be affected by sarcoidosis. Sarcoidosis can also affect the heart, and there have been cases where people would develop heart block and require a pacemaker, and even cases of sudden death from this. But the overall mortality rate from sarcoidosis is something less than 5%. Again, I already mentioned that sarcoidosis in the United States at least is more severe in blacks and more severe in women. I've never had a death from sarcoidosis in a Caucasian person before, but I have had a few in blacks that had very advanced disease. Though again, even in that racial group, it is still a rare event to have someone very severely affected from the sarcoidosis. How is it diagnosed? To prove the diagnosis, you have to have a biopsy of something showing the non-caseating or non-necrotic granulomas. That's a pathological finding. Typically, biopsies are done of either skin lesions if they are present, or sometimes a liver biopsy can be done, or a lung biopsy, or a lymph node biopsy. And your doctor will determine after reviewing CAT scans where the easiest targets are for getting a diagnosis. You can suspect sarcoidosis. You can have laboratory studies that might push you one direction or another, but you really don't know you have sarcoidosis until there's been a biopsy proof of something. Many times the presentation of sarcoidosis may look like cancer, such as lymphoma, because if you have diffuse lymph node swelling, that can be lymphoma, which is a cancer of the lymph nodes, or it could be sarcoidosis, but again, a biopsy is necessary to determine which is which. Other factors you need to know about sarcoidosis is because sarcoidosis can affect vision, you need to have an ophthalmology, which is a medical doctor, not an optometrist who does glasses, but an ophthalmologist needs to examine the patient for symptoms or findings of sarcoidosis, usually on an annual basis. And if Plaquenil is one of the treatments, it should be done every 6 months, because Plaquenil rarely can affect vision, but so can sarcoidosis. Another monitoring is that you need to have an electrocardiogram done once a year to look for conduction system defects, because sarcoidosis affecting the heart can interfere with the transmission of electrical signals in the heart, leading to heart block, which could be fatal. And there are certain things we look at, such as the QRS interval, which is a measurement we make on an EKG. If this starts getting longer, you could argue that a pacemaker should be placed prophylactically to prevent heart block. We don't really think sarcoidosis is something that you can inherit, because while it occasionally happens in family members, it doesn't happen often enough to make you think it's an inherited illness. But of course, family members many times live in the same regions and have some common exposures and have common genetic susceptibility perhaps. Over the years, there have been several people that were celebrities that turned out to have had sarcoidosis, including Bernie Mac, a comedian and actor, who died of pneumonia that was complicated by sarcoidosis, Reggie White, a football player, Evander Holyfield, and Floyd Mayweather, the boxer. Because of all the interesting associations with sarcoidosis, I personally feel fairly optimistic that a cause will be identified. Perhaps it's an abnormal immune response against some sort of plant virus or other material that is common in coastal areas, and that will probably sooner or later be identified. It's a relatively rare disease, but there are enough cases around that there are plenty of people to study and enroll in various clinical trials for treatments. We don't have any means of preventing the disease, and again, for most patients, it's just a nuisance that has to be followed from time to time without very many significant symptoms. But sarcoidosis can definitely be a very serious illness for people that have active cases and advanced disease. Thank you for tuning in and watching this talk. If you have suggestions for other talks you'd like to hear about, post it in the comments and I'll get back to you. Feel free to share the video with people that may be interested in sarcoidosis or have a family member with the disease. Subscribe to the channel for more content. Until next time, see you later.